Thank you for inviting me on this session. My name is Dr. Tarun Sahni, and I'm an internist who has been working in the field of hyperbaric oxygen therapy for the last over 25 to 30 years. Hyperbaric oxygen, as the name indicates, hyper is for high, baric is for pressure, and oxygen is the delivery of oxygen under high pressure. The field of hyperbaric oxygen therapy started almost prehistorically in the 70s when deep sea divers who suffered from decompression sickness were treated in metal chambers called hyperbaric chambers. And since then, hyperbaric oxygen treatment has found growing indications, especially in the field of medicine and surgery. So much so that now all major hospitals across the world are looking at incorporating hyperbaric oxygen therapy as part of their treatment. So what does hyperbaric oxygen do? Hyperbaric oxygen basically, as we increase the pressure, it pushes more and more oxygen into solution. So for the same person at the same time, normally one would be carrying close to 0.3 milliliters of oxygen per 100 ml in solution in our body. Whereas by increasing the pressure, we can increase the amount of oxygen to almost 5 to 6 milliliters. This additional oxygen goes to different parts of the body and has irrefutable evidence that it helps things like wounds which don't heal, diabetic wounds, radiation tissue damage. In the last decade, there has been an increasing awareness of hyperbaric oxygen, not only for mainstream medicine and mainstream indications, but also in the world of wellness. Wellness industry has grown exponentially using hyperbaric oxygen treatment, and the logic given there is the same, that as you increase the pressure, oxygen goes into solution, and this helps to remove all the free radicals in the body and prevent any further deterioration in the clinical condition. So wellness industry has come up in addition to the industry which is clinical medicine and surgical industry. The challenge we are facing now is that over the next 5 to 10 years, a large number of centers are going to come up. More and more evidence-based, hospital-based clinical centers will come up, and the field of hyperbaric medicine will grow without any doubt, and many more patients will be benefited with the use of hyperbaric oxygen. On the wellness side, it is still a little disorganized and unregulated, and there is a growing anxiety that this particular industry on the wellness side using hyperbaric may actually go out of control and we may not be able to harness the energies. There is a role of hyperbaric in the wellness industry, there is no doubt, but we also need to understand that as there is a growing need for newer specialities and newer indications and newer modalities to come in, it has to be supported with good education, training and expertise to help manage and run these centers. So it is a responsibility of the industry, it's a responsibility of the doctors who are practicing this field and who have experience in it to be able to bring in more and more people who will undertake training and will undertake the improvement of the services which hyperbaric oxygen can offer their clients or their patients, whichever way we might look at. So where are we in the future? We are currently at about 50 to 60 hyperbaric centers in hospitals or in the medical industry in India. There is a growing need, and we feel that in the next 10 years there will be at least 200 centers offering hyperbaric oxygen on the medical side. On the wellness side, there are few elite centers which have come up in India, including one in Delhi, and they're offering hyperbaric oxygen in addition to a lot of other new wellness modalities. And this industry is likely to grow immensely, and we cannot make a prediction, but if we go by the way hyperbaric is gaining acceptance in wellness, then it may be we will also have another 100 or 200 wellness centers within India who are offering hyperbaric oxygen. A word of caution to all the patients, all the clients, all the agencies which are stakeholders in this industry of hyperbaric medicine. It's extremely important to ensure that we have a good, trained, experienced manpower and we need to plan to build this manpower to support the growth which hyperbaric oxygen is likely to see in the next few years. Thank you.